Good afternoon. My name is Travis White. It's my goal today to discuss the importance of recognizing the diagnostics difference in some of the psychotic disorders. So, before we can get into some of the psychotic specifics of those disorders, it's important to identify the elements that qualify a psychotic disorder. So, understanding the diagnostics and treatment guidelines is imperative when treating a psychotic disorder. It requires great knowledge of the key elements that must be present for diagnostics of a psychotic disorder. So before an individual can even begin treatment and begin a plan for therapy, the individual must present at least at minimum two of the five key elements that the DSM-5 states when assessing for a psychotic disorder. Those five psychotic factors are delusions, hallucinations, disorganized thinking, disorganized behavior, and negative symptoms. So, for us to understand the differences, we need to have a better understanding of those five key elements. So, starting with delusions, Dr. Tracy Marks does a great job of breaking down delusions as a fixed false belief. This is not just an individual that is overly confident, has a high ego. It's someone who has an abnormal, outlandish claim and cannot be proven wrong. Perhaps an individual who believes the FBI is following them, and regardless of proof or logic, that individual will not relent with that ideology. Secondly, hallucinations. Again, Dr. Tracy Marks explains greatly that this hallucinations can manifest in all five senses, but most commonly it is in vision and auditory. Oftentimes, individuals will hear background noises or voices and see figures that are not present, and so those manifest in those senses. Those are the hallucinations. The third key element is disorganized thinking. So, disorganized thinking, once again, in the DSM-5 was stated more formally as a thought disorder, but it mainly presents itself as an individual with speech disorganization. So, this is not just an individual that struggles to communicate or has speech, um, maybe um, disorganization. It more so is between switching back and forth from topics or answering questions that are not asked. The specifications that it must distinguish between common disorganized speech and incoherence, and it has to affect the linguistics in a severe way that affects their communication. Another disorganized factor would be disorganized behavior. This broadens over a realm common to disorganization. Most create impaired social work and relationships. So the DSM-5 characterizes it as abnormal motor behaviors. It can take shape and may establish in varying forms. Some present in a giggling, maybe a silly, schoolish giggle or unprecedented agitation. Other behaviors may be established, such as catatonia or staring or grimacing. And so this is abnormal to a normal interaction. Lastly, our negative symptoms. Those are contrary to the four previous, which are positive symptoms. This is a negative symptom. Often is expressed by diminished emotional expression or reduction of one's expression. Individuals experience this factor. They may lose eye contact with others or not make eye contact with the outside world, sit in spaces, not showing much expression for a long period of time, really a disconnect from the outside world for an extended period of time. A lot of people express that the individuals around them are more cognitively aware of this negative interaction, this negative symptom, rather than the individual themselves. So, to diagnose someone with a psychotic disorder, the individual must present, again, a minimum of two of these key elements. Once you have two or more of these key elements for a psychotic diagnosis, then one must distinguish the difference between some of the more common symptoms that exist within some of those psychotic disorders. So consider the difference between schizophrenia, schizoaffective disorder, and schizophrenia informed disorder. All three of these have similarities and can present in varying orders, but quantifiably, the differences exist for the sake of diagnosis. So, schizophrenia is a more serious psychotic disorder that impairs the individual from what is real and what is not real. Dr. Tracy Marks remarks that the features of cognitive differences, organizational problems, and impaired thought processes are some of those key determining factor. So schizophrenia is not episodic, it is not episodes, although there may be ups and downs. It's consistent over months of these symptoms lasting longer than 6 months. This disorder likely presents, it can present at any time, but more commonly it peaks in early 20s for males and late 20s for females. Contrary to schizophrenia, though, schizoaffective disorder is more episodic. It does have episodes. So, due to the nature of the combination of the two disorders, an affect disorder, um, commonly bipolar or depression, schizoaffective disorder, um, is is affecting both of those diagnostics with the effect of the emotional feeling as well as the cognitive working simultaneously. It creates a difficulty in diagnosis. However, there are some distinguishing factors that separate the two, mainly the presence of a primary diagnosis rather than the combination of the collective both at the same time. So an individual that presents with primarily a psychotic symptom rather than most of the time with depressive or manic state, we can gather that that individual would be a schizophrenic diagnosis compared to a more depressive or manic symptoms. And then in um, the episodes that they're not present, the beginning, maybe the end, they have a psychotic episode. We could gather that maybe that's schizoaffective, that those psychotic episodes are in the breaks of their more manic or depressive state. Schizoaffective disorder is later prescribed or described in the DSM as episodes of psychotic key factors in the periods when there is an absence of those manic and depressive states. So this describes these ups and downs as well as the consistent psychotic disorder. An individual schizophrenia doesn't have those breaks. These two disorders are distinguishable primarily with those factors. So, lastly, schizophrenia and form disorder can present in a similar symptoms, but there are some distinguishing factors that dictate the diagnosis. So, one of those main distinguishing factors, they do meet the criteria of two or more of the key five key elements. However, there is more of an inconsistency in their longevity of symptoms. So this disorder must exist for longer than a month, but oftentimes doesn't surpass 6 months without a recovered state or individual having some normal um, periods of time. So the individual can have periods of recovery. However, the majority of the eventually will be diagnosed with schizophrenia or schizoaffective disorder. As we look at these three factors or these three specific disorders, it shows how important modifiers and specifiers are. Modifiers and specifiers allow us as a therapist to make diagnosis with greater precision. And specifiers are key ingredients to help clinicians dictate the nature of disorder more clearly. It allows us to better understand the symptoms that are present in the person's life and be able to critique and analyze that individual for treatment. Another aspect of those is to give great accuracy to the clinician as we begin to plan for a treatment for the client. The more specifiers and modifiers that we can communicate or be communicated to by our clients, the better representative we can have in our diagnostics in our treatment plan. So lastly, we begin to plan for these treatments. The proper medication prescription for psychosis disorder is paramount. Our main ethical guideline through the AC is to help our clients. Having the adequate information from those modifiers and specifiers will allow us for better prescribed medication and treatment. All medication has potential side effects. As clinicians, the more information we can gather about those symptoms and clients' experiences, the better we can diagnose, and hopefully, the faster we can work toward creating a plan and treatment to allow those symptoms to